Thank you very much. We continue with the balanced approach, which is supply suppression and drug demand reduction. On the supply front, we continue with our interdiction and legal processes that has to do with the arrest or collecting intelligence on drug-related activities. You know, having our drug-led, intelligence-led operations, investigations and prosecution of offenders. And within that front, the agency has done a lot to try to build the capacity of our staff, as well as the capability of the agency to effectively and efficiently bridle drugs and related activities. Understanding that that is one aspect of it, because you have those that are dealing and trafficking, but you also have those that are using and perhaps not dealing in it, which brings the aspect of what we call drug demand reduction, which is the unit that I head, because I'm both the public relations officer and the head of the drug demand reduction. Okay. And this has to do with prevention, treatment and care, harm reduction, alternative livelihood, and alternative development programs. And we believe that the supply front, building the capacity of our institutions is very important. It's in line with UN Sustainable Development Goal. And at the same time, on this demand reduction aspect, you know, working on how do we try to prevent drugs. On the health aspect, it's also in line with UN SDG 3, which is on promoting good health and well-being. This is what management has seen that it's important to integrate sustainability in what we do. And as such, we know that the Gambia does not have a specialized drug treatment facility. So therefore, there is a need to heighten and strengthen prevention. And as such, what we do is we conduct weekly radio talk shows. In fact, we have one over GRTS, Star FM, Islamic Al-Falah Radio, among others. We also have school sensitization programs that we do on regular basis. We visit schools. If you check our page even, just last week, our team completed a regional school sensitization program, which was not only to sensitize the youth, but also establish more clubs within the provincial areas. Because most of the time when you are here, your efforts are focused here. But the goal was to how do we decentralize what we do so that we engage our officers at that level and connect them with the school so that they can integrate it in their program. And this was reinforced by a tour that the Deputy Director General, alongside our Director of Intelligence and our Director of Operations also had, which they completed on this Friday, engaging district authorities, our staffs at that area to strengthen the aspect of prevention.
Let's talk about the strategy. What warranted the strategy, catching them young?
Yes, this is also very important because, you know, this is one of the age, human beings are also social beings. And we live in a society. And whether we like it or not, in societies you have different people doing different things. And these students, you have the home. It's one environment. They learn from the home. They come to the school, they also learn different things within the school setting as well. And in these two different environments, you have different people from different backgrounds that are also interacting. And people might take positive behaviors from some and also at the same time negative behaviors. So we felt that yes, we have to do a lot because we always say that the youths are the future of tomorrow. But at the same time, they are the leaders of today because the leaders of tomorrow are built today. And in order for you to do that, you should be able to give them the right information because threatening people that drug does not solve the problem. What they say is that it is out there. This issue of drug is a global problem. And I always say this, there is no nation on earth that can boast to have totally eradicated it. So what do? We felt that we must try to build the aesthetic and artistic capacity of our young people so that they can understand what the reality is. If they are confronted with this situation, they know the right choice that they should make. And this, I think, is among the reinforcing factors. And this is also in line with international recognized standard of best practices. Yeah.
Now, marijuana, according to the records, is the most widely abused drug in the Gambia. Now, talk to us. Are we seeing orders that belong to the family of synthetic drugs?
Yes, thank you very much. I think across Africa, because if you check the WENDO report, which is the West African Epidemiology Network on Drug Use, and also the PINDO report, which is the continental report, cannabis continue to account for the variety of drugs. But most of the time when we talk about this cannabis, people limit it to cannabis sativa, forgetting that there are different derivatives of this cannabis that exist today. Today you have what we call cannabis resin, which is hashish. You have cannabis ruderalis, which is called skunk. It's also a form of a synthetic kind of drug that is highly very potent. But most of the time when you talk about cannabis sativa, when you talk about marijuana or cannabis, people limit it to cannabis. So within that category as well, we're seeing the coming into the illicit market of what we call this cannabis skunk, which is, as I said, very highly potent. And at the same time, countries like Sierra Leone having the problem of kush, we are arresting some quantities of kush here and there, and it's also a very highly potent drug that can even turn people to like cannibals or put them into immediate psychotic episodes that can be highly devastating on their mental well-being. On the aspect of the controlled drugs, synthetic drugs, you see before we talk about the diazepam, clonazepam, which people talk about RAS, but today we are making some huge seizures of ecstasy. Ecstasy also is very highly potent, and it's another drug that you can say mostly only the boys or the male folks use it, but now it's a drug that is kind of appealing to both sexes, male and female. And at the same time, as I tell people, it depends on what you do, your income, where you party, your environment, your social lifestyle, and what is available there. So we're also seeing the advent of synthetic drugs. But also, people discuss these issues and look at them in isolation, forgetting some other drugs that may not be under our control, which are alcohol-related beverages, energy drinks that are available in the market that have vodka content, very high concentration of vodka, sometimes 18%, 22%, and now today you're seeing 22%, 30%.
It's an increase.
Yes, you have this gin, very dry, strong gin that youth will use without even diluting.
Both male and female
using it. It's appealing. You go to those who go to club life from naturalistic observations and information, they tell you that some will tell you that I don't take the one that is sugary. I want something that is bitter.
The hard ones.
Yeah, so and in the use of this, you have to look at the profile of the people and how they use them. They use them in combination. Somebody can buy the energy drink and take the ecstasy pill and look at it and put it inside.
The drink.
And so that the drug can become more potent, because the more you use this drug, the more your system becomes tolerant. And in order for you to get the dopamine release and get the same high, you need to increase the dose. So yes, we have cannabis among the prohibited. We have the controlled drugs, ecstasy and others. But also, it's important. It's not under our mandate. But if you are to address it, you need an integrated approach to understand what the problem is. Otherwise, you bring a wrong solution that does not address what the problem is.
Quite interesting. And of course, Mr. Saidyba, over the years, emphasis has been on prosecution. Now, would you consider anything like rehabilitation?
Very well. It's very high in our agenda. As I said, drug demand reduction has different pillars: prevention, treatment, and care. Treatment is important. Prevention is important. They reinforce each other. It's just like if you treat me for malaria, you don't tell me how do I prevent myself from getting malaria. I'll come back for treatment. And in drug treatment, why it's very difficult is the issue of what we call relapse. You can come, treat the person, and everything, he goes back and he goes into it because of them. So we are very much concerned on it. And this is why we've not just been engaging the student, but we've engaged partners. We engaged the ECOWAS Commission, and I speak to you, the discussion is at a very advanced stage. This was something that would have been launched by 2020. But because of the advent of the COVID-19, the contractor who the ECOWAS Commission was handling everything, gave the contract to, indicated that his inability to proceed with the contract because of changes in price. So if he couldn't do it by that procedure, we had to do everything again. So not just to have the facility, but we worked on building the capacity of people. We partnered with the Colombo Plan Drug Advisory Program with sponsorship from the US INL to build the capacity of the mental health nurses, social workers, our workers, some reform addicts, about 2 of them, religious leaders, so that we can build the capacity on what we call the universal treatment curriculum. Because it's one thing to have the facility, it's something different to have people who have the capacity to run the facility.
Right. Mr. Saidyba, many thanks for talking to GRTS News File.